Good morning, students. Welcome to my channel. I will talk about today the role of DEXA in diagnosing osteoporosis. So, what is DEXA? DEXA full form is Dual Energy X-ray Absorptiometry. This is a non-invasive medical test that measures the BMD, which is bone mineral density. And by this DEXA scan, we can measure the bone mineral density and can diagnose pathologic conditions like osteoporosis. Now, what exactly is osteoporosis? Osteoporosis is nothing but a systematic skeletal disorder which leads to low bone mass. That means the mass of the bone will be reduced. The microarchitectural deterioration of bone tissue leading to bone sterility and consequent increase in fracture risk. That means if the density of the bone is reduced, there is a high chance of getting fracture. Now, what are the risk factors of osteoporosis? The first one is the vitamin D deficiency. Then second one is the tobacco smoking. The third and important was the malnutrition and the steroid induced osteoporosis. Now, how the DEXA scan works. So, before going to the work principle of DEXA scan, we need to know that you need to know about the equipment or the DEXA scan itself. So, DEXA scan designs is based on the CR principle. Like CR, in this case also the X-ray source is below the patient and the detector is above the patient. And here you can see this is the detector array, this is the scanning arm, this is the bed where the patient is lying on, and this is the X-ray source. And these beds can move sideways and horizontally. This scanning arm also can rotate through the horizontal axis. Now, how the DEXA scan works? So, from this X-ray source, the photons are produced from X-ray tube, and there is two different energy level of the photon beam that is interacted with the body. The first peak absorbed by the soft tissues and another peak absorbed by the bone. Now, which one is absorbed by the soft tissue? The low energy one is absorbed by the soft tissue and the high energy one are absorbed by the bone because the high energy have more penetration power than the soft energy beam. Now it creates a 2D image in the software itself, and after that the software subtract the soft tissue amount from the measurement and gives a solid measurement of bone mineral density. Now, how we diagnose osteoporosis with DEXA scan. So, before going to the process, we need to know the measurement site from which we diagnose the osteoporosis. So, basically, there are three measurement sites or three area of interest from where we scan the area and give the BMD. Like from number one is the hip region, second one is the spine, and the third one is the forearm. Now, there are two scores by which we can determine the osteoporosis. The first one is the T score. What is T score? It represents the difference of your bone density from the average bone density or healthy young adults. That means the bone density of yours will be compared with the bone density of a average young adult's bone density. And the second one is the Z score. So how Z score is compared? Z score is compared with the bone density to the average values for a person of your age and for your same gender. That means if your age is 21, your bone mineral density will be compared with the 21 age of someone, and the gender will be also same like you. So how the T score determines? So from -1 to +4, your bone density is normal. If it is lower than -1 to -2.5, that means you have osteopenia. That means you have pre-stage of osteoporosis, which is low bone density. And if your bone density is much more reduced than -2.5, you are considered as osteoporosis. Here you can see how a osteoporotic bone look like. So this is the healthy bone, which is shown like there is calcium, fibers, and all minerals are included. But in osteoporotic bone, there is a lack of minerals inside the bone. So, what are the advantages of DEXA scan? In if we compare to other scan modalities, what it gives better than the other scans? So, dual energy X-ray absorptibility, that is DEXA, is commonly used for measuring bone mineral density and considered the gold standard for assessing osteoporosis and fracture risk. The number one advantage is accuracy and precision. DEXA scans provide accurate and precise measurements of bone mineral density, and it also uses low radiation exposure. That means if we are comparing it with other modalities like CT or fluoroscopy, it have much more higher radiation than the DEXA scan. And it is also speed and convenience. That means DEXA scans are relatively quick and non-invasive, usually taking only a few minutes to complete, which makes it more compatible towards the patient to go through DEXA scan. Thank you so much for being here. If you have any query, you can comment it down. Please for not forget like and subscribe to my channel for getting and latest videos on radiology related topics.